Good afternoon, good morning, wherever you are in this world. It could be evening, I have no idea. You could be in Europe, right? We do get people from Europe watching our programs. So I want to tell you all that this is an MS Views and News program. I'm live here in Columbus, Ohio, right? Great. Awesome, everybody. And we have a nice crowd here today. It's nice to see people finally getting out of their houses and coming out to do an MS program again. I mean, how easily it was it was difficult for people to find things to do with your time, right? When you couldn't go anywhere. All right. And when you started to be able to go somewhere again, it was like, I got to find other things to do. And then you found other things to do and you said, wow, I don't have time to go to an MS program. Well, they're starting again. So the pharmaceuticals are starting again and MS Views and News has started again. And today's program, you hear at the it's called the MS Immune System Forum, all right? And my name is Stuart Schlossman. For those that don't know, I'm president and founder of MS Views and News. We have a lot of supporters, and don't mind me, but, I got older over the years, and I need reading glasses. All right, so today's supporters, our title sponsor for today's event is Bristol-Myers Squibb, and our silver sponsor is Sanofi Genzyme. And aside from them, we have a lot of exhibitors that we had here today. So the list of exhibitors, we had Novartis, Horizon, Janssen, Genentech, Alexion, Bristol-Myers Squibb, MS Views and News, and Dr. Boster's center is here as well. So we do want to thank everybody for being here. So let's thank them for being here and supporting this event. Thank you. All right. Megan Weigel is a nurse practitioner, and she has OMS Yoga, which is an in-person yoga class in Jacksonville, Florida. She's also been doing this online, I believe, and she's not going to be speaking about that. But she is also president of First Coast Integrative Therapies, which is a lot of what she will be speaking about today. So her talk is about nutrition, lifestyle, movement, relaxation, and other things that benefit the immune system. Megan's going to speak with you about this for about 35 minutes, and then we're going to do 30 minutes of Q&A.
Thanks, Stuart. Hi, everybody. I'm sorry that I'm not there in person today, but it's just really a tremendous effort that Stuart and his crew takes to get these shows on the road again and then make them hybrid so that we can help out more people. I can see that there's almost 100 people tuning in virtually, and I hope that you guys there in Ohio are enjoying being together safely and enjoy the show. My name is Megan Weigel. I'm a nurse practitioner at First Coast Integrative Medicine in Jacksonville, Florida, and Universal Neurological Care. And today I'm going to talk to you about supporting the immune system with lifestyle changes. And I'm not going to give you, I'm going to give you some tips and tricks, right? But I'm also going to tell you why these things work. Because I think if you, we all know that things that we do, changing our lifestyles towards adapting healthier things, make us feel better, but we may not realize the seriousness of it and the seriousness of the things that we're doing that are unhealthy when they hit our bodies and how that may affect our MS and our immune systems. And so since the theme of this talk is our immune system, I'm going to provide a very bird's eye view of the immune system and MS and talk to you about some key players that Drs. Thrower and Dr. Boster are going to elaborate on in greater detail during their skit. I'm going to describe how disease-modifying therapies affect the immune system, again, very briefly. The crux of the talk is going to be about how lifestyle changes can support your immune system. I'm going to talk about nutrition, movement, mindfulness, and even just taking care of your MS. And then because everyone wants to know about supplements, I'm going to talk about supplement safety and why those of us who are involved in integrative medicine, which is truly a crossroad between conventional medicine and non-conventional therapies, are judicious about recommending supplements. So let's move to the immune system and MS. This is a really busy slide. It's quite complicated, but basically, what happens in MS initially is failure of tolerance to self-antigens that causes autoimmunity. Well, what does that mean? It means that the things in your body that belong to you should not be seen as enemies. They should not be seen as traitors. There's a tolerance. We have a tolerance to ourselves, basically, right? But over time, things make us angry. And so our bodies basically turn traitor. So failure of tolerance to self-antigens causes autoimmunity. And in the case of MS, that autoimmunity is turned against myelin. Now, we have a brain, right? You guys know you have a brain and a spinal cord. You have a not visible to the naked eye, but visible under a microscope, blood-brain barrier. That blood-brain barrier keeps the central nervous system really just locked up and shut tight from things in the body that can cause excessive inflammation and damage. There should not be much immune action inside the immune system because of the blood-brain barrier. The door is locked, so to speak. But inflammatory reactions that occur as a result of that autoimmunity open these tight junctions. So the doors start to unlock in the blood-brain barrier, and then cells and proteins that should not be in the central nervous system enter. So which cells are these? Well, we have T cells. We used to think MS was just a T cell disease, and we couldn't quite explain why people who failed our older therapies back 20 and 30 years ago did well when we gave them B cell therapies. Now we know that MS is a T cell and a B cell disease. So when your body's making T cells, it makes T helper cells. And these T helper cells differentiate into other sorts of cells. They produce a cell-mediated response to things that they recognize as normal or as foreign. In MS, there's an imbalance of CD4 cells, and these CD4 cells can be Th1 cells, which are inflammatory, Th17 cells, which are also inflammatory, or Th2 cells, which are anti-inflammatory. In MS, that inflammatory shift overtakes the anti-inflammatory cells. That inflammatory shift in T cells is caused by things like interferon gamma, tumor necrosis factor, certain types of interleukins. And what these things do is they cause, as I like to say, like a waitress comes up with the lock and key for myelin on its tray. It's called an antigen presenting cell. And the immune system looks at it and says, that looks like it doesn't belong here. And so then it causes this inflammatory attack. It causes these interleukins and these cytokines to be released from T cells. And the anti-inflammatory T cells, which are good, they may even cause some good inflammation, get out of balance. So what happens next? Well, then the B cells get involved. The B cells produce antibodies against that waitress who's presented the antigen presenting cell. They activate T cells, and they travel with T cells across the blood-brain barrier to produce more antibodies to myelin. You're going to hear some additional terms from Drs. Boster and Thrower today. In character, they'll be in character. And additional terms are APCs, like antigen presenting cells, and specifically dendritic cells are very involved in MS. Also macrophages. Macrophages are like the cleanup crew of the nervous system. And inside the central nervous system, the most prevalent or prominent macrophage is called a microglia. And microglia clean up messes, but they also clean up things we need. So a good way to describe the job of a microglia is to go and clean up sites of inflammation. But what might happen is they clean up a little too much. And so the job of microglia might actually cause problems. For example, people who have other autoimmune diseases like Crohn's disease or rheumatoid arthritis often complain of cognitive issues. And it's really unexplainable because those diseases are supposedly outside the central nervous system. But we now know that that cognitive problem is probably caused by microglia behaving badly. Another term that's really important is a type of cell called an oligodendrocyte. Oligodendrocytes produce and nourish myelin, and they are often the target of attack in this immune attack in the central nervous system. So let's talk quickly about how disease-modifying therapies affect the central nervous system, because you'll see a lot of these terms again. We can see that interferons block T cell migration across the blood-brain barrier to reduce central nervous system inflammation. They also decrease T cell activation and reproduction. Glutarimer acetate changes that shift of immature Th1 T cells to be more anti-inflammatory than inflammatory. S1P receptor modulators like fingolimod, siponimod, and ozanimod sequester lymphocytes in the lymph nodes. So these lymphocytes are things like T cells and sometimes B cells, keeps them in the lymph nodes so that they can't exit and cause a problem. Fumarates like dimethyl fumarate, diroximel fumarate, monomethyl fumarate cause a more of an anti-inflammatory shift in T helper cells, cause apoptosis, or basically, for lack of a better word, it's blowing up or killing of lymphocytes and activating the NRF2 antioxidant pathway. So they're effective in that way. What teriflunomide does is inhibits an enzyme that allows the rapid division of T cells and B cells. So again, we're affecting the way that these cells, the population of the cells in the nervous system. B cell modulators cause lysis of B cells, which means there are fewer B cells in the central nervous system. Natalizumab blocks T cell migration into the central nervous system almost like Velcro. It binds to a receptor site that prevents things from getting in the central nervous system. Cladribine causes impairment of the actual synthesis from a genetic standpoint of T and B lymphocytes, which results in their depletion. And then BTK inhibitors, which are hot in the news but not yet approved, block B cell activation and immune complex mediated activation. So they disrupt inflammation and degeneration at a different point in the cascade. So you can see that our immunotherapies for MS work from anywhere from a broad action to a much more specific one to affect the immune system. So let's move on to integrative medicine. You guys, many of you have heard me talk before. I'm sure you've heard me give the definition before, but it never hurts to hear it again. It's a healing-oriented medicine. It takes into account the whole person, including all aspects of that person's lifestyle and all aspects of that person's life. So the therapies that are recommended are based on understanding a person's physical, emotional, psychological, and spiritual aspects, not just their medical diagnoses. And it really involves a close relationship between a practitioner and a patient to provide the least invasive, least toxic, and least costly methods to facilitate health. Integrative medicine truly involves shared decision-making because a person may seek integrative medicine in hopes of not choosing a conventional therapy when they may need to understand that conventional therapy can be used in a safe way. So much of what I do involves explaining to patients that the things sorry, I'm helping my son with a snack here, that the things that they might want to consider can be used safely in conjunction with more holistic therapies. This is a nice table that I think helps define what I consider to be the wellness industrial complex as it is produced on social media and the internet, because there is so much happening right now in these fields. So I practice integrative medicine, which I think should be moved closer to conventional medicine. Alternative medicine is used in place of conventional medicine. Complementary medicine is using an alternative therapy, say acupuncture, for example, in addition to conventional medicine. Integrative medicine uses both things together in a coordinated way and is based on evidence. And then functional medicine is more based on naturopathy, which is a wonderful science, really steeped in biochemistry and the chemical reactions that happen in the body. It's based on systems biology, and it focuses on treatment and prevention. But much of the data for things that we recommend or that may be recommended in functional medicine is based on animal models and hasn't really been proven in humans quite yet. Also, if a person is working in the conventional medicine space, they may recommend a lot of supplements, and they really should be very familiar with the medications that you're taking and the disease states that you have, because many of those supplements can aggravate the disease states and even block the function of the medications that you're taking. All right, so lifestyle changes in the immune system. It is no longer a myth that physical and psychological stress cause low-grade inflammation in the body. You know, really, I think that most conventional medical providers, physicians, MDs, DOs, NPs, PAs, nurses, would probably not roll their eyes at that statement anymore. We know that stress is bad. We know that long-term physical illness is bad. It harms the body. So how does this low-grade inflammation start? Well, it results from various disease states like overweight and obesity, chronic stress, trauma. It results in various disease states, so vascular disease, cancer, autoimmune disease, and increased risk for infection. So it results from certain things and then causes certain things. But this low-grade inflammation can be modified. It can be modified by making healthy nutrition changes, can be modified by reducing your stress level, and it can be modified by exercise. I love this slide. It comes from a functional medicine course. Over here on the right, we've got Humpty Dumpty, and I like to say all of us are Humpty Dumpty. All of us have the potential to fall off the wall. So what causes us to fall off the wall? Well, we're born with genetic, a certain genetic makeup. Some of us have genetic makeups that make us more prone to certain diseases than other people. There are some genes that are quite scary, and there's very little that you can do to modify the activation of that gene. But there are some genes that will never turn on that may be associated with chronic illnesses. So how do those genes turn on? Well, they turn on by things that happen in our environment. They turn on by what we maximize, minimize, and prioritize. And so if we are eating a diet that's full of processed foods, living in highly stressed environments, living in an environment that has a lot of toxicity, if we've been chronically ill over our lives, if we have essentially attacks on our body, then this may cause those genes that might not otherwise activate to activate. So again, we have choices that, based on our choices, activate things in our biochemistry, our hormonal systems, our immune systems, our nervous systems, digestive system, metabolism, the way we make energy, the way we clear toxins. And those things can result in either wellness or illness. If we're well, we stay on the wall. If it results in illness, we fall off the wall. So we're going to talk about nutrition first. My favorite quote is, "Eat food, not too much, mostly plants." I've got a lightning bolt here separating the good choices on the left from the bad choices on the right. And what we're trying to do is move from a highly processed diet where food is mostly made from chemicals, it's highly processed, there's refined grains, refined sugars, very little color. You can see that this diet is mostly tan, white, and brown. We're trying to move from this diet to one that is full of color, full of whole grains, phytonutrients, flavonols, nuts, seeds, healthy fats versus trans fats and saturated fats. And why are we trying to do that? Well, my favorite article that I could read over and over and over again that was written by Dr. Alana Katz-Sand, who is at Mount Sinai in the MS department, gives us a review of why diet may help modify the course of MS. So receptors from foods that are high in fiber and omega-3 fatty acids actually stimulate anti-inflammatory effects. So when you eat foods that are high in fiber and high in omega-3s, there are actually receptors in your body that get turned on to produce anti-inflammatory chemicals. That's amazing. It makes it a lot easier to make a choice for, say, having avocado toast on whole grain bread instead of a donut. You put that donut in your body and you're increasing pro-inflammatory chemicals like interferon gamma and IL-6. You put that avocado toast in your body and you're stimulating anti-inflammatory chemicals. Flavonoids, which are chemicals that are found in those bright colored fruits and vegetables, activate anti-inflammatory effects as well. Short chain fatty acids are a fatty acid that's made in the gut from high fiber foods. Those short chain fatty acids actually produce anti-inflammatory cytokines. Foods that are high in polyunsaturated fatty acids are anti-inflammatory. In animal models, there's actually evidence for neuroprotection from polyunsaturated fatty acids. Higher levels of intake of fruits and vegetables are associated with reduced relapses and disability. This statistic comes actually from NARCOMS data. NARCOMS is the North American Registry in MS, and there are thousands of data points from which we can draw conclusions. Foods high in fiber from whole grains, fruits, and vegetables actually activate receptors that decrease the recruitment of inflammatory cells and proteins. And then I already mentioned what saturated fats can do. Long-chain fatty acids, which are often from processed foods, seed oils like safflower oil, sunflower oil, sesame oil, and foods high in omega-6 stimulate naive T cells to become Th1 and Th17 cells. And if you remember back to our original biology lesson, those are inflammatory cells. Saturated fats, foods high in omega-6 and sugar increase the risk for vascular disease. Well, guess what? Having one vascular comorbidity and MS increases the risk of progressing to an EDSS of 6 by 6 years sooner. So that's high blood pressure, overweight or obesity, high cholesterol, diabetes, peripheral vascular disease. I think it's important to speak about omega-6s for a second. Most animal proteins, particularly red meats, are high in omega-6. I don't advocate for people to stop eating animal protein if they don't want to, but what becomes important is the ratio of omega-3 to omega-6. In general, Americans eat too much omega-6s, so you just want to shift that ratio, and that's why most of your plate should be plants. Let's talk briefly about exercise. I prefer to use the term movement for exercise. I think it takes a little bit of the pressure off. I think it takes adds a little bit more joy into what we're doing. The words diet and exercise often cause people to just throw up their hands right away and say, I can't do it, I have no willpower, right? So let's talk about bringing these healthy things into our diet to make our bodies work better. Let's talk about moving our bodies to get better outcomes. Exercise is associated with the production of a chemical called brain-derived neurotrophic factor. This chemical may be neuroprotective, even in the inflammatory response. Sorry, buddy, I can't help you right now. Even in the inflammatory response, which means inflammation can be good. We need it, right? When we get a cut, we need inflammatory chemicals and our white blood cells to go eat up any dirt that's in there, any bacteria. But it's bad when it takes over. BDNF makes that shift, keeps that shift in the good range. Exercise is also associated with a decreased risk for and improved vascular disease, and it improves mood. So what do? Well, you choose moderate exercise or movement. You aim for 150 minutes per week. That's about 22 minutes per day. If you overheat because you have MS, and elevating your core body temperature may aggravate some of your MS symptoms. My alma mater, the University of Florida, said 15 years ago that you can split up that 22 minutes and get the same cardiovascular benefit. So do 10 minutes here, 10 minutes there, and exercise during your best time of day. Stay cool. So even if you're up in Ohio right now and it's 30 degrees and you exercise, I have no idea what the weather is right now, by the way. Even if you're up in Ohio right now and it's 30 degrees, When you exercise, you increase your core body temperature. And increasing your core body temperature may aggravate some of those MS symptoms. So you still need to consider exercising with cooling equipment, such as a cooling towel or a vest, keeping cool fluids with you to help keep your core temperature down. It's also important to choose something that you like, right? Because if you like it, you're going to be more likely to do it. Enlist help, and by that I mean exercise with a partner, or if you need help moving your arms and legs, enlist the help of a support partner so that you can continue to get the benefits of exercise, and actually that person will probably get some benefit too. Let's talk now about mindfulness. This is my favorite thing to talk about. Okay, what's happening here? So it took me a while to make this slide. It's not very sophisticated, but I think it proves a point. This guy over here on the left is a caveman, and he's running from the tiger. When he runs from the tiger, his sympathetic nervous system activates. His pupils dilate so he can see more. His heart starts beating fast. He has all of these neurochemicals rush through his body so that he can run really fast to get away from that tiger. And guess what? When he gets back to his cave, he survived. All of those chemicals go away. And he goes back to being a calm caveman. So this is how the nervous system is supposed to work. Fight or flight is supposed to happen quickly and then go away so that our bodies can continue to live in a calm milieu. Over here on the right, we have what's happened to the caveman. So here's a 21st century guy. It's 2022. His tiger is no longer a tiger that goes away. As soon as he gets up in the morning, he looks at his cell phone and then he watches the news and he gets upset by the world, and then he starts drinking coffee and then he heads off to work because he's got to make money. And by the way, he didn't get up early enough to walk on his treadmill. So he's already worried about when he's going to exercise, and he may choose to start drinking alcohol instead of exercising after work because he's so stressed out because he has all these kids. And when he gets home, his wife asks him to help and he's so tired. And then he sits in traffic and he yells at everybody. So this guy, he never stops running from the tiger. His tigers are never ending. So what happens? Well, this is a chart that shows us something called polyvagal theory. We're going to have a guest here, buddy. Thank you. You can see it later. We have a chart here that shows polyvagal theory. Polyvagal theory is an unproven theory. It's not a theory. Let's call it a hypothesis. And the hypothesis is what happens to our bodies when we're shown an acute stressor versus a chronic stressor. So when our stress response is activated, which it should be every once in a while, we go into this fight or flight mode. We may feel irritable, frustrated, and then it goes away. We go from green to red, we go from yellow to green. So when we go into the chronic stress mode, we go from down here, social engagement, our digestive tract's working well, we're resistant to infection, we have a normal immune response, we can rest well, we feel healthy and vital, we're able to relate and connect to people. We're actually breathing, and we have defensive responses that are decreased. Then we go into fight or flight. Okay, our sympathetic nervous system increases our blood pressure, increases our heart rate, increases the release of adrenaline, increases our pupil size, decreases our insulin activity because we need to hold on to all of the sugar that we can, decreases our digestion because our cardiac, vascular organs need our attention, decreases our salivation, and impairs our immune response. So if we stay here in fight or flight long, in this rage, anger, irritation, panic, fear, anxiety, what can happen is this collapse. So we stay in here long enough, we begin to feel depressed, we have a raised pain threshold, we might shut down and feel hopeless, we feel trapped. What happens to our body? Well, we start to store fuel and again, reduce insulin activity because we don't want to die. And it's about time. We've been here for so long. We get immobilized by fear. Endorphins help us numb out, raise our pain threshold. We conserve metabolic resources. Our weight might increase after a long period of time. We have an impaired immune response, impaired social behavior. So this is what happens when we stay in fight or flight for too long. Fight or flight is I can do this. And then after you've been trying for so long, you move to I can't. How do we help this? We help it from mindfulness. Whew. You know, I'm a little bit in the red just talking about all that stuff. Mindfulness and meditation are not synonymous. Mindfulness is the process of being here now, 100% where you are right now. And you can do that in any way. You can be mindful when you're eating. You can be mindful when you're eating dinner with your family. You can be mindful when you're exercising, mindful when you're working. Meditation is a form of mindfulness. It improves the immune response without an increase in inflammation. So boosting the immune system isn't always a good thing. It makes the immune response more normal. It stimulates activity in areas of the brain that control emotions and help the immune system function better. So when they see an insult, when they see the tiger, the brain is actually better able to control emotions and make better decisions. Mindfulness and meditation result in a decreased fight or flight response, in a decrease in inflammatory factors like some of the ones we talked about earlier, interleukin-6, TNF-alpha, C-reactive protein, and NF-kappa B, and an increase in anti-inflammatory factors like interleukin-10. So one of the ways that you can decrease that chronic fight or flight is just by knowing what's going on in your body and taking care of your MS. Rather than putting it off and putting it off and putting it off, keeping regular MS checkups is important so that you can address concerns that you have. Making sure that you're getting annual MRIs as is recommended, or if you have a different pattern of MRI screening with your MSologist, then following that pattern. Asking about changes. Do you have any new symptoms or have you noticed changes in your disability? It's really important to communicate those to your physician. Is your disease modifying therapy working for you? Is it working for your MS? Are you up to date on any lab monitoring or any specialty follow-ups? Are your symptom management medications working for you? Do you need a rehab tune-up? Do you need any specialty referrals? And how about your other medical conditions? How are those? Sorry, my son just ran away. He's running from the tiger. So taking care of your MS can actually reduce that fight or flight response, and it's really important. So now let's move on to supplements for the last few minutes before I move on to questions. Americans spent an estimated of $227 billion on nutraceuticals in 2020. That is insane, in my opinion. Because here's the thing, folks. You can spend thousands of dollars per month on supplements. If you're putting them into a body that is working overtime to work against you, they're not really going to help. It's so much cheaper and safer and better to change your diet, to add in exercise, and to add in some form of mindfulness. This number is probably a little bit inflated because so many people started taking supplements due to COVID, but it's an insane number. What are the benefits of supplements? Well, I hate fruits and vegetables. I'm just not going to eat them. I can get my fruits and veggies in a pill. Okay, that's fine. Probably still not as good as eating them because when you take them in a pill, it doesn't fill up your belly, doesn't give you all that good fiber. But if that's the only way they're going to get in, so be it. There is more evidence for some supplements in some medical conditions than most people know. I have textbooks that go through the available data for herbs, botanicals, and nutraceuticals. So there is more evidence than most people know. But there's also more evidence to tell us the dangers than most people know too. And that's why when we're talking about supplements, it's incredibly important to be working with a person who not only understands nutraceuticals, herbs and botanicals, but also understands the mechanisms of the medications that you're taking and your diseases. So dangers of supplements include that they're not regulated for consistency. Quality is a concern. They cannot replicate the benefits of food. So food, the benefits of food are really complex chemical reactions of things that are being eaten at the same time, whereas supplements are given in isolation. There are supplement, drug supplement, and disease supplement interactions. You can get no advice, you can get poor advice, and you can have inadequate knowledge. So again, just important to arm yourself with information. This is my suggested algorithm for supplements and also for other modalities that are complementary and alternative, specific to MS. So is there evidence that what you want to do is helpful for an MS symptom? If there is, does that evidence outweigh the risks, including financial harm? And if there is evidence and it outweighs the risks, including financial harm, then you might want to try it. Try it for 6 to 8 weeks. Make sure it's recommended by a person who knows everything about you and what you do. If there isn't evidence and you want to try it anyway, could it be harmful in any way, or is it costly? If it is, maybe there's something else you can try, and you should discuss that with that knowledgeable healthcare provider. If the evidence for risk and harm does not outweigh any benefits, then we move on to trying something else, and we initiate the algorithm again. The other thing that's really important about other modalities is, are there realistic expectations? So many of these modalities, I mean, they may be the holy grail, they may be the fountain of youth, but we don't know that yet because we don't have evidence. So do you have realistic expectations? For example, just with nutrition alone, we don't have enough evidence to tell us that nutrition definitely modifies the course of MS. We do have pretty good evidence to tell us that it changes some things in the body that could help you to feel better and could help in addition to the other things that you're doing. So support your immune system simply and safely. That's my take-home message today. Optimal health is not complicated. You maximize what you put into your body: raw materials, air, water, healthy fats, healthy food, belief that what you're choosing is safe and effective. You minimize what's harmful. You take out stress, trauma, toxins, infections. You limit negative beliefs, fears, negative expectations, and you prioritize creating an environment for healing. And that environment includes laughter, stress reduction, sleep, rest, movement of your body, meaningful relationships, positive visualizations, and associations. So thanks for listening. I'm at 36 minutes. I think I will stop my screen share, or I can leave it up. You can tell me what to do, Stuart, and we'll go ahead and take questions. By the way, this is like the epitome of health right here in this picture.
Megan, thank you very much for everything you just spoke about. Anybody here's got a question? I know you do. That's good, and I'm glad that you spoke up there, okay? I'll hold the mic.
Okay. Hi, I'm Melissa, and thanks for
Hey,
such
Melissa.
a great presentation, Megan. I actually have 2 questions. One, do we get to have the slides following this? Because there was a lot of great information on there, and I couldn't get it all down in my notes.
I'll send that one to Stuart.
So for everybody to know, online and here, this thing is going to be on our YouTube channel soon, okay? So you don't need to take notes. And I forgot to tell you at the beginning, all right? So once it's on our YouTube channel, you can watch it and share it out with others as well. All right. You have a second question or a second? Right, you got a minute?
My other question is in regard to supplements, alpha lipoic acid and turmeric with curcumin. And I'm probably saying all of this wrong, but I'm taking that, and I've learned and read that these are 2 really good supplements for MS. What are your thoughts on that?
Yeah, so first of all, I can't make recommendations to people without knowing their whole medical history. So take this with a grain of salt. But curcumin, which is the active ingredient of turmeric, the root, is a very potent anti-inflammatory that's being heavily studied in vascular disease, in neurodegenerative disease, in autoimmune disease because of its anti-inflammatory components. We do think that it's a safe supplement. We do think that it may provide some benefit as an anti-inflammatory supplement as a whole. There's no evidence for it in MS, but it is recommended to some people. Greatest danger being that it can sometimes cause GI distress and increase the risk for bleeding. Alpha lipoic acid is studied in MS. It has been studied in a smaller study and also is now being studied in quite a large placebo-controlled, really good quality study looking at progression of disease, specifically mobility, because smaller studies suggest that it may be helpful in slowing down disease progression in progressive MS. The challenge with alpha lipoic acid is that since this larger study has gone into effect and more people are actually being monitored medically, there has been an association with alpha lipoic acid and an acute renal or kidney condition. So if you're taking alpha lipoic acid, it's very important that your medical provider knows that you are, and that every so often you're having your kidney function checked, and that you're aware of any changes in your renal function. And so that might be that your urine is a different color, or that you have swelling, really those are the two greatest things. So again, supplements, now that we actually have interest in them in MS, because they're being studied in greater detail, we now know how to recommend them safely. So I would say, as a rule, if you're a healthy person, good choices, but you still need to have things monitored while you're taking them.
Thank you very much for that. Next, we have a question from online that I'm going to get to. And the question is, should a person with MS take the shingles vaccine?
So the shingles vaccine is, I'm sorry, I'm trying to get two kids out of the house right now. Sorry about that. The newer shingle vaccine, Shingrix, is a non-live vaccine. We typically don't recommend live vaccines to people living with MS. This is a non-live vaccine. It is so much more effective than the old one, I think about 95% effective in protecting a person against shingles. It's 2 doses. I do recommend it for people living with MS.
Thank you. Anybody in the audience have a question? All right, I'm going to go over to this, and then I'll be back to online.
Hi, Megan. It's Jill.
Hey, Jill.
In the world of COVID, do you recommend supplements? And for anybody who's a long hauler, what do you recommend?
So yes, I do. It's very individualized, and it also depends on what other conditions the person has, what other medications the person is taking, and how long a person plans on taking medication. Plans on supplementing. So for example, in my practice, I've started to see a lot of people who are deficient in copper because they've been taking so much zinc for 2 years, and zinc and copper compete with one another. Zinc, the receptors look the same in the body. So the receptor gets saturated by zinc. There's no copper. This can cause a neuropathy. It can actually cause white matter changes in the brain. And nobody knows this because on the internet, it just tells you to take zinc. So Jill, it's a great question. I hesitate to recommend things for that reason. If a person is trying to prevent COVID infection or flu, I think it's safe for a couple of weeks to take extra vitamin C, to take some zinc as long as it has copper in it. It is not safe for a person living with MS to take echinacea. Echinacea can inappropriately activate the immune system. It is not safe to keep taking high doses of vitamin C for the same reasons for long periods of time. It's not safe to keep taking high doses of zinc for long periods of time. For a person who has long haul issues related to COVID, we treat those a lot like concussion, even in conventional neurology. The supplement that I recommend the most is something called N-acetylcysteine, but the FDA has actually come out and said that that shouldn't be recommended anymore. It's hard to find. It is a real medication. We give it to people with kidney disease to protect them from contrast. We give it to people who've overdosed on Tylenol. So I think if you're having issues related to long haul, the best thing to do is to get a comprehensive evaluation by your neurologist specific to your situation. And if you're trying to prevent COVID infection, I would keep wearing a mask. I would wash your hands really good, and check with your doctor before you take high doses of supplements that supposedly prevent the illness.
Thank you for that answer. And by the way, Megan, I want you to smile for a minute, because I got better quicker from my COVID, I believe, from the concoction of complementary meds that you told me to take, because it just took a few days after that where all of a sudden I was feeling like I'm on top of the world again. So thank you for your input.
Yeah, and I'll tell you, really, if you want to safely prevent COVID, you can do the things that I mentioned today. So eating a plant-based whole foods diet that's full of fruits and vegetables that are colorful and high in omega-3s. All of the supplements that are recommended to prevent COVID are basically the chemicals that come from those healthy foods. So start there.
Thank you very much. All right, next question for you. People want to know about vitamin D, what you could tell them about that. And then they're also about zinc, how much is enough to take? Evidently brought up something that they're questioning.
All right, so vitamin D is, really a cornerstone of MS treatment. If you have vitamin D deficiency or insufficiency, if you don't have kidney or liver problems, then most MSologists want your vitamin D level to be around 50. I definitely recommend having it measured before you start taking supplements. Challenge with that is most insurances don't like to pay for it, but it's not too expensive. If you can afford the small cost of it, I would go ahead and get it checked. Low vitamin D is associated with an increased risk for MS. Low vitamin D is associated with an increased risk for relapses and MRI changes. So it is considered to be important. As far as zinc goes, I don't recommend taking it. If you've been exposed to COVID and you want to take zinc, I would take no more than 25 milligrams a day for no more than 2 weeks. And I would make sure that there's copper in the preparation that you're taking. They very often are sold together in a pill.
Okay, thank you. Next, a person is asking how much vitamin C is too much to take for an already vamped up immune system.
Yeah, so the recommended daily dose of vitamin C for a person living with MS is actually no more than 250 to 500 milligrams a day. Usually you're getting that in your multivitamin.
Okay, next, what does one do if eating fresh vegetables and nuts causes issues in the mouth, eyes, ears, somewhere? Can't click.
Okay, so that person may have a hard time. Many nuts and seeds and some vegetables, particularly avocados, are high in histamine. Sounds like that person may have a histamine issue or just a sensitivity to those foods. If you're having a hard time tolerating a healthy diet, I would ask your either your primary care provider or your MS provider for a referral to a nutritionist who can help you sort those things out.
Great, thank you. Before I go on with the questions, there are so many people writing in about what a great job Megan does and when is she going to be near them? I think when she could get away from Dane, right?
Yes.
Okay, but I do have great news for those in the Lynchburg, Tennessee area, because we will be there with Megan live in the middle of June to do a program, which you'll be finding out about soon. Okay, thank you. All right, Next, a person is writing about your gorgeous little boy. Okay. Next, what do they have? Does Medicare cover alternative medicines?
No.
Okay.
Medicare may cover acupuncture. I'm not sure. Medicare may cover chiropractic care. I'm not sure. I don't believe that Medicare covers the cost of supplements.
All right. Thank you for that. Next, what's the question? How do you recommend CoQ10, and do you recommend CoQ10, and how much do you suggest?
So the best evidence for the use of CoQ10 is for the prevention of migraine headache and also for heart disease, particularly arrhythmia and high blood pressure. In migraine, it's 100 milligrams 3 times a day. We used to recommend high doses of CoQ10 for Parkinson's disease, but the jury's out on the larger studies didn't suggest that there was much of an effect on that. But that being said, CoQ10 is a very effective antioxidant. Taking 100 to 200 milligrams per day is likely safe as long as you run it by your healthcare provider and make sure that it doesn't interact with any of your medications.
Okay, thank you. For those that are asking questions online, please know that we do have a few to go, and we are running out of time, but I do want to get to this one because it's an important question. A person is asking, what do you consider long haul, and what do you mean by everything you've been saying? By long haul COVID.
I'm not sure.
Long haul COVID.
Okay, I'm not sure I understand the second part of the question. What do I mean by everything I've been saying?
Okay, forget that part, and let's just go to the first part.
Okay, so long haul COVID or acute post-COVID syndrome, I think is what the ICD-10 code is for it, refers to a person who has continued issues following COVID. Those issues may be related to the cardiovascular system, to the respiratory system, or even to the GI system or the neurologic system. So some people have, they've gotten over their acute infection. They had COVID, months ago, but they're still struggling with their breathing. They're maybe struggling with their heart rate. They're maybe struggling with a chronic fatigue type syndrome. So that's what we're referring to by long haul syndrome.
Okay, thank you. And next, are there any benefits from taking liquid chlorophyll? Go to sleep, right?
Yeah, so I'm just not a big supplement taker on a daily basis. Chlorophyll is a great supplement. It's detoxifying. It helps pulls toxins out of the body. It's a great green. So chlorophyll is something that you can put in a smoothie every now and then. If you've been exposed, to something that you feel is toxic in the environment, you can take chlorophyll for a few days after you've been exposed to it. Hopefully that's helpful. Not really sure about that scientifically. But there really isn't a reason to take chlorophyll every day, unless you're sucking down environmental toxins all the time. One of which might be using single-use plastic water bottles, in which case you could just buy a steel one or a glass one or an Nalgene bottle and not have to take chlorophyll. So that's my feeling on that. It's certainly something that you can add in every now and then if you want to, but not something that you should need to take daily.
Okay, thank you. Next, a person wrote in, being on a fixed income, how are people supposed to afford to be able to eat healthy these days with the rising cost of everything?
Yeah, that's a great question. So one resource I'd like to give is the Environmental Working Group. It's ewg.org. Every year they come out with a list, 2 lists. One's called the Clean 15 and one's called the Dirty Dozen. The Dirty Dozen is the list of fruits and vegetables that you should always buy organic. The clean 15 is a list that they're usually, not toxic, so to speak. So you can take a look at those so that you can, kind of do your grocery shopping accordingly to buy good fruits and vegetables. The bottom line is eating them, period, is better than not eating them at all. I look for sales at my grocery store. So if one of the dirtiest fruits, for example, probably the dirtiest is apples, but other ones are strawberries and blueberries. Strawberries being really dirty. So when organic berries are on sale in my grocery stores, I buy a bunch of them and I cut them up and freeze them. So that's one way. Another way would be to buy frozen vegetables that are organic. Sometimes they're a little bit cheaper, but not always. And again, I think just changing your eating habits from moving towards a diet that is more full of fresh foods than processed foods is better than worrying about whether or not you're eating organically. Now, fresh foods are more expensive than processed foods. That is for sure. But guess what is also much cheaper than processed foods? Health. So having to take less medication because you're eating healthier and your blood pressure comes down and your diabetes is better managed and your cholesterol comes down can save you upwards of hundreds of dollars a month.
Okay, last question, and thank you for that answer. Last question.
Yeah.
How many jars of complementary meds need to be on a bathroom shelf before they get enough to take to feel better? In other words, some people feel like others are offering for them to be like very over-medicated on taking even supplements. And what is too much?
So that's probably my biggest soapbox with the internet, the wellness industrial complex, social media, all of these people who are health coaches and integrative providers, and all the things that they almost make it seem like if you don't take them, there's no way you can enjoy better health. So I would say foundationally, most people with MS should be taking vitamin D. They should have their B vitamin, B12, folate, B6 levels measured and supplement for deficiencies or insufficiencies. They might want to talk to their healthcare providers about taking alpha lipoic acid if their kidney function is okay. And for other medical conditions, there are other things. Magnesium can help with constipation and headaches and muscle tension. But it is so much better for your bodies to make healthier food choices than it is to take 20 supplements a day.
Thank you very much.
I'll just say it's very, very easy to get liver toxic from a lot of supplements. Even though the front of the bottle might say this has one thing in it, when you turn it over, there are other things. One of the things that's often added to supplements and minerals is vitamin A. It's very easy for the liver to hang on to too much, and you can actually have elevated liver enzymes and even liver failure from that. So, when that shelf starts getting filled with more than 3 things, I'd be concerned.
Thank you. And that's true. Thank you very much for everything that you spoke about today. To everybody, thank you
guys
for doing this.
Have a great day.